Hello, everyone, and welcome to this special live stream. We have a very special guest here today, Dr. Luiza Schmidt, who just matched at one of the top 3 cancer hospitals in the United States for radiation oncology. Luiza, before I even turn it over to you, congratulations. What a huge accomplishment. I was blown away by this, tremendous accomplishment. Like our Trump would say, huge. Very good. So congratulations, Luiza. Can you start off with a quick introduction?
Sure. Thank you for having me here today. My name is Luiza Schmidt. I grew up in southern Brazil. I went to medical school in Universidade Federal de Santa Maria, and I graduated in medical school in 2023. Since then, I moved to Dallas to work as a research fellow at UT Southwestern in the radiation oncology department, and recently I matched in radiation oncology at Memorial Sloan Kettering. So very happy to be here.
That is an incredible accomplishment. If you guys don't know, Memorial Sloan Kettering is, like I said, one of the best oncology hospitals in the world, in the United States. Up there, probably with Dana-Farber here in Boston, MD Anderson, Mayo Clinic, some other really great cancer hospitals. Memorial Sloan Kettering certainly there at the top. So, Luiza, we're going to jump right into this because a lot of people will relate. Because they want to match in a great program, because they want to match in a super competitive specialty. People want to know your secret. They want to know how you do it. But before we get into the nitty-gritty of your application, I wanted to ask you, why radiation oncology? It's not a specialty that people consider a whole lot. I personally didn't have a lot of exposure in radiation oncology during medical school. So walk us through the decision or why you considered and chose radiation oncology as a specialty, please.
Yeah, sure. I think that was the most common question during the interview trail, and also my favorite one. So the reason I went to medical school is because I would like to be a cancer doctor and treat cancer patients. I was inspired by my grandfather during my childhood, and since then I decided I would like to treat cancer patients. But I think I was very frustrated during medical school with cancer treatment in Brazil and in my home school. The patients were diagnosed very late, and we only had few options to offer them. So I was very frustrated with that, and I was drawn to diagnostic radiology initially. I really enjoyed the imaging aspects of this specialty and the technology behind the specialty, but it was not 100% fulfilled because I was not treating patients, and that was my goal when I went to medical school. So I applied for my electives in the US during my last year of medical school. I had the opportunity to do my OA rotations at Cleveland Clinic, and my first month was in radiation oncology. So during the first week, I immediately fell in love about this specialty. For me, it was the perfect blend of treating cancer patients and guiding our treatment based on the images. So basically, that's why I decided to do radiation oncology. I really enjoy the time we have with patients and how we can offer them treatment and better care.
Yeah, it's fantastic. It's, like I said, a specialty that people don't often consider, and you can cause a tremendous impact in people's lives. I mean, I see that remarkable contrast with cardiology. Cardiology is still cardiovascular disease is still #1 cause of mortality, but patients just off the fear, and they fear cancer so much more. And obviously, when you get that diagnosis, it's a huge impact in patients' lives, and then being able to treat that and help patients, makes a big difference in their lives. So I'm really glad that you found a home for you in this very remarkable specialty. How long is training in radiation oncology in the US?
So it's 5 years. The first one is an intern year. You can decide like a transitional year, a surgery prelim, or internal medicine prelim. I will do my intern year here in Dallas in internal medicine. And then the radiation oncology training is usually 4 years, with 1 year dedicated to research. Usually, okay. Depends on the program. But
very good. That's another advantage of this specialty. Not only you have the impact like we talked about, but it's a shorter training than, for example, I did 9 years of residency and fellowship, internal medicine and chief and cardiology and imaging. It took forever to train. And it is good that you can do a little bit of a shorter training. Very good. Are you excited to start? We're excited starting in a couple of months. Yeah.
Yeah,
Good.
absolutely.
Yeah. Intern year is going to be different, of course, because you're not jumping into radiation oncology. You're jumping into internal medicine, you said, right? The prelim year. Yeah. So you're going to be ready to be done with internal medicine real soon and jump into radiation oncology. That's great. And Luiza, let's walk through how you put together this remarkable application. So let's start with the research fellowship. You're in Texas right now, UT Southwestern, I believe, correct?
Correct.
And if you could share a few words with how you got that research fellowship, how you applied for it, also how you stood out, because I am 100% sure you did a really great job and people loved you there, because they would have had to recommend you highly for you to have a match at the level that you did. So just give us some tips on how to be extraordinary in the research fellowship, please.
Yeah, so during my elective at Cleveland Clinic, by the end of my rotation, I talked to my mentor there that I would be interested in applying to radiation oncology and asking for some guidance and what would be the next step. And he recommended me to do a research year. I explained that my fiance was living in Dallas and I would like to move to Dallas and move to UT Southwestern for my research year. And he helped me with that. He connected with some radiation oncologists here and talked that I did a great job during my electives there. Nice. So that's basically how I found this position here. I'm working with adaptive radiation therapy for CNS tumors, more specifically glioblastoma. And I really enjoyed this year. About my job here, I think you always have to demonstrate that you're very committed with what you are doing and is very passionate about what you're doing. For example, for me, I'm from a very rural area in Brazil. And basically what we are trying to do is to reduce the number of treatments, the number of radiation from 30 days to 5. So I understand how difficult it can be for our patients to spend sometimes 6 weeks away from their home. And if we can do this treatment in 5 days instead of 30, that would offer them a way better quality of life. And that would be great. So I am very excited about that. And I think that was important during this year to keep me motivated, and also during my interviews when I was talking about that.
Yeah. No doubt about it. And I'm sure you did a really great job in the research fellowship as well. You're clearly very passionate about it. When you speak, you transmit that, you pass that forward. I'm sure that caused a great impact when you interviewed you, because you're very passionate about radiation oncology, about your research, and about the impact that you cause in people's lives. Since we're talking about research, I'm really proud to say this. It's one of the highlights of 2025 for me so far, is that Luiza Schmidt has participated, has taken our meta-analysis program. So this is one of the publications that Luiza participated in. This is a meta-analysis on the prognostic value of PSMA in patients with metastatic prostate cancer. She has other publications as well, other meta-analysis. And I want to ask you, Luiza, what do you think that, how do you think these publications and having the meta-analysis, that experience, was that also helpful for you in your trajectory as you applied for this residency position?
Yeah, absolutely. So even with the research here, the publications will take a long time to be accepted and for you to be able to submit something, especially if you're working with original studies like clinical trials or even retrospective studies. But original research will take a long time, usually. So with the Meta-Analysis Academy, I was able to publish some works before applying to residency, and it was extremely helpful because having some publications supported when I said I was interested in research, because it showed that I really worked on that. And yeah, I think it was great. I learned a lot. The part about the statistics was also very helpful for my research year. And having a better understanding about meta-analysis is always helpful when you're reading some papers and things like that. So it was also, I was able to receive an award from this publication that you just showed during RSNA.
Yeah. So
And
let me tell people what RSNA is, because they may not be familiar. RSNA, guys, is one of the biggest conferences in the world. They do it in Chicago only every year because it won't fit that many people in other cities in the United States. So Luiza, tell us about the award you won for this publication here at RSNA, please.
yeah, so I think the name is Association of Women in Radiology and Radiation Oncology. They have awards like for residents and trainees, and for faculty who is publishing and presenting at RSNA. I was presenting this meta-analysis, and I was selected to receive the awards in the trainee category. So competing with other residents and research fellows, which was great.
Did it come up during your interviews? Like, hey, you got this award,
Yeah, it was during the interview season. It was after I submitted the application, but I reached out some programs saying that I received the award, and it was always good to say.
Right, RSNA is typically in November, right? So you had already applied, so that's good. That's the best time to get an award, and during interview season, something that you can discuss as you go through. Yeah, I just came back from Chicago where I won this award. It's a great thing to say in an interview. That's really good.
Always good to mention.
Before we move on from this research topic, there's other things I want to ask you, like your preparation for the steps and all of that. But before I move on, just because I have the publication up, something else I noticed here, the first 5 authors here and Dr. Adriano, they're all students, alumni of the Meta-Analysis Academy. Stefan is a professor. He teaches diagnostic meta-analysis in the program. So I wanted to ask you also how these connections with Miriana, with Giovanni, Felipe, Stefan, Adriano, and others, if that was also helpful, like being connected in the community that publishes a lot of research, if that was helpful to you.
Yeah, definitely. That's my favorite part about the Meta-Analysis Academy. I think the connections we developed, and maybe I'm wrong, but I think it's MetaMasters, the name of the program.
Yeah.
When we are able to connect with mentors and have some guidance.
The experts program. You're talking about the experts program.
Yeah. Sorry, the experts program. Yeah, that was my favorite part. And we published some more papers together because I think we just did a great job together. So I really liked it.
You guys are clearly a great team, because I see a lot of publications from this group. So just to explain to people what the experts program is, in the Meta-Analysis Academy, our students, after you learn the process, they put together their own ideas, they create their own projects. And with that, they're able to invite collaborators and submit these applications to experts. And the experts like Dr. Stefan Altmaier, like Dr. Adriano, will help and mentor and guide the students through these projects. So I'm really glad you enjoyed that, Luiza. All right, moving on from research, you clearly did very well. Tons of publications, research awards, research fellowship. So I have no doubt that was an important component of your application. Let's talk about the steps. I'm pretty sure I'm not going to ask you to share your step scores, of course, but I have no doubt that you did really well in step 2. Do you think? Could you share a little bit about preparation, about like your study techniques or material, or any insights that you may have as someone who's been very successful on how you prepared for step 2? Because I'm sure your score was really high.
Yeah, I think the best advice for step 2 is take as close as possible from step 1. There are a lot of overlap in the content, and that's not actually what I did. So I took step 1 in 2021. I had a score on my step 1. Now it's pass or fail, but I had a score. And at that time, I was planning to apply for my electives, and I didn't have time to study for step 2. So I postponed my step 2 exam after my graduation and after I moved to the US and started my research fellow. So it took a while for me to be able to study for step 2. And that was not a good idea. But I think doing like the key banks, you rolled flashcards, and I think basically that's what I did for step 2. Self-assessments to see how you're doing and having an idea about which score is your goal and trying to focus on that. Yeah, I think that's what I did. It was not easy, especially trying to do the research fellow and studying for step 2. For me, it was difficult, the transition to US and studying for step 2. But yeah, if I can recommend taking step 2 close to step 1, I think it would be a good idea.
Great. No, I agree with that. I hear that from a lot of people. I took mine 9 months apart from each other. I think it helped, to get that foundation. Now, still moving forward in the number of things that are important for match, interviews is another one that come up. You had a lot of interviews. I think you had like 40 invitations. I'm not sure did you interview in all of them, on all the 40 or no?
So to be fair, I think I had like 35 in radiation oncology,
Okay.
and 10 for like the intern year. So it was like 45. Yeah, basically. So I had to decline some interviews because I had like conflict of the dates. It was not just possible to interview in 40 programs, but yeah, it was a lot.
What are some of your advice, like to interview well? You're a really good communicator. Just from talking to you here for 20 minutes, you communicate very clearly, effectively. Your thoughts are very organized. But like, do you have any advice for people to prepare for the interviews? Did you do anything special or different that you think helped you?
Yeah, so for interviews, I think you have to be yourself. Mock interviews are helpful to try to prepare yourself for the most common questions, but you will be asked a lot of unexpected questions during the interview season. So it's important to know yourself and to know what image you want to show during the interview day. Yeah, I think, let me see what I did to prepare. Yeah, I would say mock interviews and trying to be honest to yourself when you're answering the questions, because you want to be in a program that you will be happy with the program and you can be yourself during your residency. So I don't think pretending to be someone that you are not will help.
That's really good advice right there, what you just said, because you said that you also want to make sure that you're going to be happy in that program. So I think people often don't consider what you just thought, because what you just said, because they're always thinking about how they can match. But the reality is you want to evaluate the program too. Of course, if you have a very limited number of interviews, like you won't have that problem, or you won't have to do that. But when you have, especially if you have a considerable number of interviews, you want to interrogate, you want to interview the program too. So ask questions, and I think Luiza's insight is really helpful to everyone. Just think at what's in it for you also, not just how you're trying to sell yourself to the program. That's good advice. Now, Luiza, when we of course know a lot of people in Brazil, where we're both from, internationally, I have a lot of students in the Meta-Analysis Academy, people who are trying to come to the United States, and people are often either trying to get a very competitive specialty or match in a really high-ranking program. And you did both. Which is incredible. You picked a really hard specialty and you matched in one of the top 3 programs. So I wanted to ask you if there's anything else besides what I've already asked, high step scores, doing well in a research fellowship and on your rotations, doing a lot of research, publishing meta-analysis, all the things that we already talked about. Do you have any other insights or recommendations for people to achieve either or both of those things, matching a competitive specialty in a competitive program?
Yeah, I think for matching a competitive program or even in a competitive specialty, you need basically everything perfect in your application, which is impossible. Like, it's impossible to have a perfect application, but you have to try. You should do your best, and in every step, like try to do your best on step 1, step 2, have the best score as you can. Even in medical school, I think the MSPE is underrated for us as an IMGs, but for me, it was very important, and it was mentioned in all my interviews, basically.
Oh.
So if you were like the best student in your class, that can be very helpful. So some awards can be important too, publications, and I try to present in my application all different skills that I could, like leadership, volunteer, research. I think having a little bit of everything was also helpful. And yeah, I think the interview day is extremely important as well. So yeah, basically everything.
But I think that is the key message. I think that if you want to do really well and match in a competitive specialty or match in a competitive program or both those things, you have to have a complete application. You can't get 276 on the step 2, but not have any publications. You can't publish in the New England and Lancet and not have any US clinical experience or have a poor letter of recommendation or have a low score. I think that is the key message from this. Not just for competitive specialties, but for everyone. You should aim to have a balanced application. Yes, it's helpful to have 30 papers, but much better than have 30 papers is have impactful research, also have good scores, also have good recommendations. I think if you build that balanced application, I think it'll get you further every time. I think that's really good advice. Would you agree, Luiza?
And I didn't mention, but networking is always important and can help you a lot. The letters of recommendation also are extremely important. So
yeah, I have a special word about networking here, that in people who are early in their career, for people who are early in their career, they don't understand exactly what we mean when we say networking is really important. Networking will be helpful at the highest level when people really get comfortable in recommending you, when they would either write you a long, great letter of recommendation or send an email or call someone on your behalf. And you're only going to get at that level of networking, of results, if someone's going to advocate for you, if they trust you, if they worked with you enough. And that at the fellowship level, you can get that networking in residency because you've worked with the same attendings for years or months and they know you really, really well. Like your program director is a form of network. But at the residency level where Luiza is, the only way you get meaningful networking is by either doing research, a research fellowship, or if you're really, really lucky, in a clinical rotation. But it's tough to get there with a clinical rotation for 2 weeks because people won't have the level of trust that they have in you yet. Luiza did that extraordinarily well. You guys heard her say she went to a rotation. She developed a great connection with someone there who recommended her to a research fellowship in Texas. And then I'm sure she did so well during her research fellowship that this helped her get good letters of recommendation. So this is the level of networking that really works. It's not the one where you just meet someone at a conference, and then they're gonna get you an interview. That's not how it works. But I agree with Luiza. Strong networking, strong connections will be a very important component of this. Certainly helped her as well. Would you agree, Luiza?
Yeah, 100%.
Very good. I'm going to finish off with one question here. I'm going to put Camilla's question here on the screen. And Luiza, I'll let you take this one. Do you think doing a research fellowship first is important and then 1 versus 2 years? If you have any thoughts on that, please.
Yeah, I think that's a good question. It depends a lot. Like when was your graduation in medical school? I think it's important to be fresh grad as much as you can. So I wouldn't recommend like way more than 2 years of research before applying. But sometimes when your PI is hiring someone, they will be looking for at least 2 years. I don't know. It will depend on the expectations for the project. For me, it will be like 1.5 years. And I think it's difficult less than 1 year to have like enough publications, but way more than 2 years, I think maybe it's not the best because it will be far from your graduation. So I would say something between 1 year and 2 years.
Yeah, I totally agree with that. Like Luiza said, a lot of PIs and labs will not want anyone for a short period of time. So I think in that 1 to 2 year range is very common. Well, Luiza, thank you so much. This was really inspiring. I learned so much from you. I want to congratulate you again. I've said this a million times, but it's deserving. Like you're really hardworking. The other people there in your group have excellent things to say from you as well. So I'm really, really happy with your match. It's historic for an IMG to match at Memorial Sloan Kettering Radiation Oncology. Congratulations. Well done.
Yeah, thank you so much for having me here and for the opportunity, and also for offering the Meta-Analysis Academy.
Absolutely. I want to just, in the final minute, invite everyone listening to join the Meta-Analysis Academy as well. We teach methods, statistics, writing of systematic reviews and meta-analysis at the highest level. You learn from the very basics, no matter what your experience is, all the way to very advanced. Luiza, we're very proud to say Luiza is part of our alumni. So click the link that's going to be here below and join our wait list as well. Luiza, thank you so much. It was great chatting with you. Get some rest, and then intern year is coming right around the corner in the summer. So looking forward to that. All right. Thank you, Luiza. See you guys. See you, everyone. Bye-bye.